England. And after I did all what I had to do, I came back home to serve, and I've been here for the last 26 years.
Lovely.
Enjoying every minute of it, of course. It's good because you feel useful.
Yes, definitely.
And urology, maybe talk a little bit about urology. What is urology?
Mm-hmm.
A lot of people mix it up with neurology, because I suppose it sounds the same.
Yes.
But neurology is to do with the brain. Urology has to do more with the plumbing.
Yes.
The kidneys, the bladder, anything to do with the urine. And with kidneys, though, not to be mixed up with a different type of kidney specialist who's a nephrologist.
Mm-hmm.
I would deal with kidney problems that need surgery, as opposed to nephrologists would deal with the kidney problems that need medication or dialysis. And just thank you very much for giving me the opportunity to be here. It's been a long time since I've been on radio because I've been so busy.
Yes.
But I see things have changed quite a bit.
Well, we try to keep up with the times as much as possible. But I'm really happy that you found the time and accept the invitation to be here, because a lot of what we'll be talking about this evening, very important, especially, and I want to emphasize, especially to us males, So let's start. Well, you briefly mentioned about what urology is all about.
Yeah.
So in that field of medicine, what are some of the common complications that are involved that you attend to on a regular basis?
I would say that, first of all, I deal predominantly with men. Mm-hmm. And we deal with women too, but men have a lot more urine issues than women do. And that's because men have a prostate gland, which women don't have.
Right.
And so the prostate gland gives us problems. I think it's safe to say that every man, sooner or later, will develop urine problems. And they all originate from the prostate. Of course, some men experience more problems than others. But by far the prostate. And with the prostate, people are very concerned about prostate cancer, very concerned with prostate is getting larger, and men seem to be more preoccupied with the size of their prostate rather than whether or not it's cancer.
Okay.
But I think the mistake is because people equate increase in prostate size with cancer, and that's not necessarily the case.
Oh, okay.
You see, but in Grenada, prostate cancer, I would say, is the biggest problem because it's the most dangerous. Not the most common prostate issue, but it's the most dangerous prostate issue. But also too, it's fair to say that of all the cancers, prostate cancer is the most common cancer in Grenada.
Okay.
We would hear about breast cancer and cervical cancer and so on, right? For various reasons, but last time I checked, there were more cases of prostate cancer per year. And I used to keep a record of all the cases of prostate cancer we had, but more cases of prostate cancer per year than there are of breast cancer and cancers of the cervix and womb combined. Just to give you some sort of perspective, and a lot of that too is that we do tend to, while prostate cancer could be cured, 95% if gotten early, but unfortunately in Grenada we don't really get it early enough.
Okay.
In which case then, unfortunately, we can't cure it, or there's no opportunity for it to be cured, no matter where you are. So we have to now rely on trying to control it or slow it down.
Okay. I understand. So prostate, we know it's something that it moves very slow. It's not it's not as aggressive as maybe some other cancers. But when should someone start paying attention to whether or not their prostate can become a problem?
Well, we should start in Grenada and in the Caribbean, because in the Caribbean too we have, relatively speaking, a very high incidence of prostate cancer, one of the highest in the world. And that is simply because our populations in the Caribbean are predominantly black. And, you know, there are risk factors, of which race is one of the risk factors.
Yes. Okay.
You know. But, you know, we're talking about a prostate cancer, and I'm not sure whether or not, or we should make it very clear what is a prostate gland, where it is, and what it does. Right? So before we progress, maybe we should talk a little bit about that.
Definitely.
So, well, first of all, the prostate gland is unique to men. Women don't have prostate glands. Okay? And the prostate gland's primary function is to provide the nutrition the sperm need on their journey up the female's reproduction tract.
Right.
And the prostate gland is located just under the bladder, and the urine on its way out, urine as it exits the bladder, it has to pass through the middle of the prostate.
Okay.
And then goes down the penis and out. So you can see that any problem with the prostate gland can have an effect on urination. And you know, we talk about an enlarged prostate and so on. Well, normally speaking, I would say we would consider the size of the prostate to be about the size of a golf ball or the size of a large lime. Put it that way. But I have seen prostate glands the size of grapefruits. You know, yeah, they're about, you know, about that big. And quite a lot. So they can grow to be very large and give a lot of problems. The other thing about the prostate gland too is that as a man gets older, his prostate gland gets bigger.
Why not the reverse?
Don't speak to me about that one. I don't have the answer for that. You have to go to a higher authority.
Yes, indeed.
But
I agree.
that's the way it is. Of course, same way you have different sizes and shapes of people, some people's prostate glands grow naturally larger than others.
Okay.
Right? But the other thing too that I find interesting, or is an interesting misconception, people think that if they have a large prostate gland, or let me put it the other way around and say, but doc, my gland is not that big, at least certainly it's not big for my age, right? Because what might be okay for someone in their 60s would probably be considered big for a man in his 30s, if you see what I'm saying.
Okay.
But they're saying, you know, the gland is not that big, yet I'm having all these problems, and I don't understand why, if you tell me it's normal for my age. And size alone of the prostate gland is not everything when it comes to the flow of urine, because if we picture the prostate gland, let's say, as a ball, with a passage in the middle, and the urine passes through that passage in the middle of the prostate gland. As the prostate gland gets bigger, suppose it gets bigger in an outward direction, then the passage remains the same. So you can get a very large prostate that's hardly impacting on the urine flow.
Okay.
And of course, the vice versa. If it grows inwards, you can soon narrow that passage, and so you can see a lot of trouble with that, right? So I think that's one of the misconceptions that I come across a lot. But so now we have an idea where the prostate gland is located, we know its function, and we know that it's now strategically placed to cause problems with the urine.
So, a large prostate or enlarged prostate doesn't necessarily mean that that individual has prostate cancer.
Absolutely not.
Okay. Good.
No, they're two
I think this is
different issues. Yeah, that was cleared up. But as a matter of fact, it's very interesting because the three primary conditions of the prostate that give trouble. I mean, there's several, but the three main ones, well, there's enlargement, and that can restrict the flow of urine. There's also inflammation. Now, anything that's inflamed, yes, may get enlarged. You hurt your arm and it gets inflamed and it gets swollen, right? So inflammation can cause the prostate to be swollen, but that's sort of a temporary situation, but not always. Life is never always that simple, right? And that actually is extremely common, as is enlargement of the prostate. And the third, so we've now done enlargement, we've done inflammation, and the third one is prostate cancer. Now, prostate cancer is not as common as the first two, but of course it's the one that's life-threatening and most serious. So the other thing too is a lot of men, not enough men, but a lot of men are concerned about their prostate health, especially prostate cancer. And I get asked the question all the time, so doc, how do I know if I have prostate cancer? What are the symptoms? Well, ideally, we want to diagnose prostate cancer when there are no symptoms. Right? And when we do that, again, a lot of men are puzzled, because they say, but doc, you're telling me I have cancer, but I'm feeling well, I'm urinating well, right? And the reason for that is that the cancer is, at this point in time, too small to cause urine problems. Okay. But that is the time when it is highly successfully cured.
Okay.
By the time you get problems, it's late. The other thing, to get back to the question, well, doctor, what is the most common sign or symptom of prostate cancer? And I will say, well, the most common sign we have is you're peeing normally. That leads me on to say that that when you get signs from one of the three prostate illnesses, whether it be enlargement, inflammation, or cancer, they all have exactly the same symptoms. So you cannot depend on symptoms to differentiate between them. So we are very dependent on tests to tell the difference. Also, right? Now, each one of these illnesses, to repeat, enlargement, inflammation, which is called prostatitis, and cancer, they're all totally independent of each other. So while they might give the same symptoms, they're independent. And because they're independent, they can all occur in any combination. You could have all three, or two out of the three, or only one out of the three. So you see why it can be difficult, right? And I'm saying this because I don't want men who experience a little bit of difficulty to pass their urine. And I will go into the difficulties and of prostate symptoms, that they think that they have cancer, right? Because a lot of people too, when they think they have cancer, they get scared, and they don't want to go to the doctor because they don't want bad news.
They don't want to hear that.
Yeah, they don't want to. They're afraid. Not that they don't want to hear it. It's afraid, right? So I think that's a very important basic point to understand and to get across tonight, because that's not well understood in the general community.
So we know that you mentioned that the symptoms are very similar.
That's correct.
They're all very similar. So when should one consider, let's say, doing screening for prostate cancer, prostate enlargement, or anything like that?
40 years old. And especially if you have, and the reason 40, and I'm talking about the Caribbean population, right, which is mainly black, as opposed to whites or Chinese or Indian, right? So for example, in some places they might say, if you are of a race that's less risk, let's say white, because the second highest risk per race is in whites, then they may start at 50 years old. But at the beginning, everybody was 40, but now they've gone to 50. And the checks involved two things. The first is a blood test. It's called PSA. PSA stands for prostatic specific antigen.
Okay.
But we all say PSA, it's easier.
Yes.
Right? That's a blood test that's readily available in Grenada. And because of our population, ethnicity, demographics, from age 40 we should do a PSA testing. But the PSA alone is not foolproof.
Okay.
It will detect a lot of cases of potential prostate cancer. We have to get into that too, right? Because a high PSA does not mean you have cancer.
Okay.
All right? It just means that you might have it and should be looked for carefully. But a PSA could miss people who might have prostate cancer going on. And so it has to be combined with an examination. We call it a digital rectal examination. Essentially, we feel the prostate through the back passage. And again, that is something that men don't like. But I've examined thousands of men and so on, and I can tell you that, and anybody who has had that examination would say that, it's not as bad as it sounds. It's more psychological or cultural thing. But the combination of the two is the best way, because I've seen many patients who have had a normal blood test, the PSA, but when I examined them, I felt cancer, and vice versa. Right? So you asked me about what should we do at what age. Well, for us, 40 years old, 40. And ideally once a year. If you've been going for a few years, it's fine, and you don't have one of the most important risk factors, then we could make it every 2 years. Okay. But that is after you've gone a few years and we know that everything is stable, right? And a major risk factor is a family history.
Family history, okay.
Yeah. There's someone in the family who had prostate cancer. Father, brother, uncle, cousin, right? And more so on the father's side than the mother's side, although the mother's side as well. And the same way, for example, there are some genes that we've been able to identify that are associated with breast cancer. Well, men will have that gene too, and that gene, for example, BRCA1, we call it BRCA, is also associated with prostate cancer in men. And the BRCA gene, for example, is a very strong gene, to the point that nowadays, some women who have the BRCA gene, because of the risk of breast cancer is such that they would actually do a preventive mastectomy, remove the breast in advance to make sure they don't get breast cancer. I don't necessarily subscribe to that, but that's a practice that is done. I only mention the breast because most, again, for many reasons, women or men or people are more familiar with breast.
Yes.
Right?
Yes.
You hear there's a lot more publicity about breast, and so we understand the danger of breast cancer. Many people would have heard of this BRCA gene, if not by name, by concept, right? And we have movie stars and so on taking off their breast for this. So I only bring it up just as a risk factor to show that, this is a gene that not only occurs in women, but also occurs in men and manifested as prostate cancer. But certainly the family history. Right? Okay. And be very, very careful with that. And so someone does a PSA and it comes back as high. Again, that's not a diagnosis for prostate cancer. That just means that, look, you may have it, and we're going to do all that's necessary to look for it, because that's the only way we could sit back and say, listen, you don't need to worry for now. We don't know what's going to happen down the road. So when someone comes with an elevated PSA, generally speaking, the cutoff is 4. Right? Elevated PSA, and we do all our checks and so on. We could, if you want, we could talk about the process subsequent. But we do all our checks and comes back as no cancer. Well, we thank God and we're grateful, but we don't say goodbye, have a good life.
Right.
No, you have to continue your checks because you're okay today, but we don't know what's going to happen tomorrow.
Okay.
Right?
Okay.
So I think that's another important point to make.
Right, indeed. Doc, we need to take a short commercial break. When we come back, once that is over, we'll come back and we can chat some more on some of the issues. So stay with us, folks. We'll be back with you in just a moment.
Drug abuse, cancer,
measles, diabetes.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so clear to see. Peace of mind, that's a service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillean Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spicile Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spicile Imaging provides an authentic MRI scan. Here's another little known fact. Spicile Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grand Anse. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679 or 406-1500 or visit any of our 3 locations. Spicile Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
If prosperity really matters to you, come home to Grenada Cooperative Bank. Since 1932, we have shared the same values: financial diligence, investing with prudence, transparent compliance, consistent performance.
Welcome home, Grenada.
No matter the economic climb, we always stand the test of time.
Welcome home, Grenada, the bank that goes the extra mile. Welcome home, Grenada, the bank that serves with a smile.
Welcome to a bank you can truly call your own. Grenada Cooperative Bank.
We care because you matter.
Co-op Bank. Welcome home.
Saturday, May 28th, Flavors Entertainment presents Flavors of Calypso, featuring live from Trinidad, reigning Calypso monarch Terry Lyons, alongside the master Crow. Also from Trinidad, reigning ex-tempo king Brian London, as he comes up against Powder and Papa, teamed with Grenada's very best in Calypso, Sour Supper, Big J, Baraka, Scholar, Woodsman Kelly, Hits, Smallies, Teacher Eddie, and more, all backed by the Hitway Band, hosted by Lister. Early bird tickets $50, regular $60, or pay more at the door. Ticket outlets: Licks and Bites Squaw, Mitchell's Pharmacy, and Grenadian Optical, St. George's, Lotto Office, Grenville, and St. David's Pharmacy. Sponsors: Playway, Coca-Cola, Dasani Water, Ken Flav Brokerage, First Class Mufflers, Mitchell's Pharmacy, GBN Radio and TV, Innovative Shipping, McIntyre Brothers, Party Shipping, Dick and Mitchell, Rampon Radio, La Suggest Nature Center, Sign Experts, Brighton and Miners, Independence Agencies, and Digicel, Terry Lyons, Brian London, Crow, and so much more. Spice Basket, Saturday, May 28th. 28.
Distributed by Calico Trading, Frequency St. George's, telephone number 439-9239.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so clear to see. Peace of mind, that's our service guarantee. We look after all our family, yes we do at every opportunity.
Antillean Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
If there was ever a time to keep and stay healthy, it's now! We at Hills and Valley are here to help you take deliberate steps to maintain your health. We stayed true to maintaining the most comprehensive rates while stocking the widest range of medicines and health devices, including personal protective equipment. There are so many benefits shopping with us. You get great savings through discounts for senior citizens and reward cards for loyal customers. Ask about owning yours today. Visit us at Halifax and Grenville Street, St. George, Jubilee Street opposite the Grenville Bus Terminal, and at Hillsborough, Carrico. Our wholesale distribution on Halifax Street also stocks the widest range of pharmaceuticals. We are with you on the hills and in the valleys. We are Hills and Valley Pharmacy.
Let's start the new year on a high, a detox high, because it's detox time again at Nirvana Detox Center, a natural health store. Check out our many detox packages starting from $100 or get 15% off on colonic irrigation therapy. Detoxing can help with liver and blood cleansing, weight loss, constipation, acid reflux, kidney stones, heavy metal removal, gas and bloating, and more. Call or WhatsApp us on 231-6642, 418-7115, or 449-7753. Ask about our delivery options. Visit us now. Bruce Street Mall, store number 1208, or Belmont St. George's, close to the Fall Edge area. Our opening hours are Monday to Saturday, 9 a.m. to 5 p.m. Nirvana Detox Center and Natural Health Store. Detox your way to health. These specials ends on March 31st or while stocks last.
Drug abuse, cancer,
measles.
Welcome back, everyone. It's Doctor in Call. Dr. Robert Yearwood is our guest, and tonight we're looking at some of the complications, especially that we face as men. And it's also important that our women listen to the program as well, because even though some of the complications do deal with men, but you have a role to play in ensuring that, you know, the necessary support and all of that. And it's believed that, you know, our women are the ones who encourage men to, well, go get checked, go see a doctor.
And come with the men too.
And come with the men.
Hear what was said.
Because the men may not tell them when they get home.
Absolutely, or a totally different story.
No different story.
Yeah. Believe me, I've seen it all.
Yes. Yeah. So we spoke a bit about the cancer. Let's talk about the enlarged prostate. What tests do we do for that? And then if it's diagnosed, then what are the treatment and things like that?
Yeah, so as I said earlier, enlarged prostate, we have a name for it, like everything else, benign prostatic hyperplasia. In short, we just say BPH.
Okay.
Right? And so that is not, generally speaking, a life-threatening condition. It's something that tends to occur gradually, and it happens in all men, some more than others. And as I said before, the urine passes through the middle of the prostate on its way to the penis, as it exits the bladder on its way to the penis. So you can see that as the prostate enlarges, especially if it enlarges inwards, the passage in the middle gets squeezed. And so that has certain connotations. But in the end, it affects the urine in several different ways. But usually it's gradual, right? And we may not recognize the change from month to month, but you would certainly recognize it over the years. In other words, an 18-year-old is not going to urinate the same as a 60-year-old man, right? For example, if you look at the force of the urine coming out, we call it the stream. You know, in a young boy, you know, with an older man, it may barely be able to clear your toes, if at all. Right? I mean, it's funny, you know, being a urologist, you notice certain things, you know, and that was appropriate. But like, you know, you go to the public bathroom and you see the younger men standing up with their feet together. But older men standing up with their feet apart and leaning in to be closer. Right? I said to myself, yes, you need to see a doctor. Right? But anyhow, yeah, so among other things, the urine slows down. And some of the symptoms, which, remember what I was saying, apply to everything, whether it be BPH or inflammation or cancer. Slowing down is one thing. The other thing is you might notice that you start to wake up in the night to go and urinate more frequently.
Okay.
You know, 2 or 3 times, most men could tolerate that quite well. When it gets to like 4, 5, 6, then a lot of men cannot tolerate that. It will get in the way of their sleep and so on. And you'd be surprised the consequences of lack of sleep. You know, really affects you the next day, and you might not even know it or realize it. But yeah, it gets in the sleep. You may notice that even during the day you are urinating more frequently than is appropriate for the amount of water you drink, amount of fluids you drink. And also too, you may find that it's becoming gradually more and more difficult to hold your urine. What I mean by that is to postpone urination.
Okay.
We call that urgency, where like when you have the feeling to go, you have to like stop what you're doing, go and come back, right? I mean, there are various degrees, and of course, these things are not progressive. Right? You know, just go from one point gradually to the other. Sometimes they get worse and then they back off. Or you might have a problem one day and not the other. In other words, intermittent. But it's a gradual trend in one direction. So yes, you may develop urgency. And you find there's hesitancy. It's not coming right away. You have to be a little patient and wait a while. Some men have to force, other men just sort of relax, and the urine comes, and it comes okay, but you notice it's coming slowly, but it's doing its job, right? It's all coming and all coming out. You might even notice that before you finish, it stops kind of like halfway, and then you have to start all over again. Then at the end you may find that it doesn't stop abruptly. It stops, but you may have to like comes slowly, drips. You have to encourage it a while, so as make sure that everything is out. Sometimes you may feel, in more extreme cases, when it's starting to get bad, that I'm not emptying my bladder. I don't feel satisfied.
Okay.
And you may find that you have to go back and do some more a few minutes later. So those are all the symptoms, and men have various degrees of. Not everybody experiences the same. Some men might have to go more frequently, and that may be the major issue they're experiencing, whereas other men find that it's coming more slowly and they're not emptying properly.
Okay.
Right? But it comes a point now when it becomes intolerable. At the beginning, no problem, I could live with that. But it always comes a point where, no, this is trouble. So you go to the doctor, right? And the doctor will listen to what you have to say, should, examine you, because you can examine, an experienced doctor in these matters can have a good idea of the size of the prostate through the examination. Again, it's not perfect, it's an estimate. Same as the ultrasound. A lot of people get ultrasounds through the abdomen, stomach, and they get a measurement of the prostate, which is fine, but it's not an absolute measurement. It's not 100% accurate. It may be off by like 10-15%, maybe even more. And I bring that up because a lot of men become, as I told you at the beginning, very preoccupied with the size of the prostate, and they go and take medication, especially they go and get online products and so on, and they want to know what was the prostate size this month, and then they want to come back and get another ultrasound and so on. What's the prostate size in 3 months? Is it working? And really and truly, the accuracy of the measurements are not suitable for that.
Okay.
Right? Because it could be 1 month it could be a certain size, and another month a different size, and then the third month back to how it was before. No, right? But that's something that we see a lot. So go to the doctor, and the question I like to ask a lot, because I want to have some idea of how much is this really bothering you. Because if it is not bothering you too much, then, and you could live with it, well, let's live with it. Because remember, just like hypertension, for example, high blood sugar, high blood pressure, or diabetes, high blood sugar, you have to take medication for life, right?
Yes.
So before you sort of put someone on this medication for life, you need to be fair it's worth it, right? And because a lot of people think too, oh well, I'll take the medication for a certain time and then feel better, and so I don't have to take the medication again. And you see that a lot also in the treatment of diabetes and hypertension.
Yes.
No, you have to take it for life, because if you stop, the problem will come back, right? So before you sort of condemn someone to a life of medication, you want to be sure. So I just ask a simple question. I say, listen, if hypothetically, pretending, I could guarantee you that you see what you're experiencing now, you will experience that for the rest of your life. No worse, but no better. How would you feel? And if they say, Doc, no, I wouldn't be happy with that, then that is a cue that, all right, you treat it. If they say, Doc, once I know it's not dangerous, I can live with that, no problem. Then that person, I would just do whatever is necessary to make sure that those symptoms are not cancer. And once I've satisfied myself that that's the case, then we say, fine, we just watch it still and see what goes on. But I said something very important there. I said, make sure it's not cancer. And the reason for that is, as I said earlier, all of these symptoms
are similar
for all the conditions of the prostate. All right? And then, So we're talking now about BPH enlargement. And although you can live with it today, as we get older, the prostate gets bigger, and maybe these symptoms may gradually get worse. So what you could tolerate and live with today, you may not be able to do so tomorrow, next year, 5 years' time, no problem. If that time ever arrives, then we could treat it. So usually the first line of treatment that I do, as most doctors do, is tablets, right? And they help. They don't shrink the prostate. Right, that's the other thing. The most common first line treatment is actually just to encourage the flow, because once you're flowing good and everything is well, you don't care about the size, right? And I find it very interesting how these tablets work, actually. The reason I find it interesting is if we could think of the prostate as a ball, with the hole in the middle, that's the passage, and you hold a ball in your hand and you squeeze it, you could appreciate that tension would put pressure on the passage and restrict flow through the passage. Well, it so happens that the prostate is enclosed or surrounded by a certain type of muscle. And let the prostate be the ball, and that muscle be your hands squeezing the ball. What that medication does, it relaxes those muscles. And in relaxing those muscles, eases the tension and improves the urine flow. And very often, that's all that it takes. Right? But furthermore, too, the bladder is protected by, let's call it a similar muscle, let's call it a valve. And that valve is usually closed. Because if that valve was not closed, as your bladder fills up, urine will escape and be wetting itself. That's the function of the bladder, because our kidney is producing urine continuously, 24/7, and that urine is stored in the bladder. And when the bladder is full, it lets you know it's full. You get the sensation, and then you go, and the act of passing urine involves relaxing that muscle. This medication also helps that muscle relax, so things pass better. So that does not reduce the size of the prostate, but it certainly helps the urine to flow better. We do have medication that also reduces the size of the prostate. But you may ask, well, doctor, why not put me on that medication? Right? And it's quite simple. First of all, it does not reduce the size to normal.
Okay.
Right? It may reduce the size by 30%. So that means now, if you are getting trouble with the passage of water and your prostate is not that big, then giving you that medication will not work, because 30% of a little bit is still a little bit.
Yes.
Now, if your prostate is very large, 30% of a lot is a lot.
Yes.
All right. So first of all, you have to meet that criteria, right? And remember what I said, that if you can have a small prostate that gives trouble because the growth is kind of inward and blocking the passage, right? So let's talk about smaller prostates blocking urine and bigger prostates blocking urine. It's not inconsistent when you realize that concept.
Okay.
It's all about the direction of growth, right?
Because I was going to ask you that. If you take medication to shrink the prostate, what if the growth is on the outside and then the shrinking takes place from the outside? Does it have any effect on easing the passage for the flow of urine?
No, not really, because there is no problem, if you know what I mean. There is no problem, right? So, but when I talk about inside growth and outside growth, I'm just being very simplistic for the purposes of description. But I should really say, if proportionately or relatively speaking, the growth towards the inside is relatively more than the growth towards the outside, a smaller prostate will give more trouble than a bigger prostate, right? But the fact is you're presenting with problems, so we give you that medication that could shrink the prostate by about 30%. So that's the first thing. The second thing is that medication, the first medication I talked about, let's call it medication, that works quickly. You get the maximum benefit in a few days' time. The one, what I would call, let's say the shrinking one, takes about 6 months to see the benefit or the maximum benefit. And I choose my words correctly. I say maximum benefit because if after 6 months it's not working for you, then it's unlikely to work if you take it longer. But if you're not getting the results you want before 6 months, don't be impatient. Continue to give it a chance, right? So to give someone a medication, and this medication, by the way, is more expensive than the other, right? So to give somebody a medication, ask them to pay money for 6 months, and we're not going to get a result, you could understand now that's not the first line of treatment, right? But I often, with experience, you have an idea what is what, and as a matter of fact, in the right patient, we give both of them at the same time, right? We tackle the problem from two different ends, and there's, as a matter of fact, a medication rather that combines the two. So you get two medications in one tablet, right? So that's the first line of treatment, and what that does is, in old time days, the only option would have been surgery. But this medication now saves a lot of men from having surgery because it works, it cuts, it works. It wouldn't make you pee like a young boy, but it reduces the problem to a level that you can tolerate.
Okay.
All right? And once you could tolerate it, well, you don't need to go to the extreme of surgery, because remember, surgery as a rule of thumb should always be avoided, should always be a last resort, whether it be in urology or anything else, right? So and you'll get an ease and benefit, and you continue taking this medication for life, because if you stop in no time at all, the problem will come back. And we see that quite often too, Now some men, for whatever reason, they have a very high tolerance for these symptoms. See, that's another thing too. So I didn't say it, but it's implied. The decision to treat is not the doctor's decision. You go to a doctor and says, yes, you need to take this medication. I need to treat this for your own good. But the decision to treat is determined by the patient or by the patient's tolerance to the symptoms or problems they are experiencing. Some men barely get any trouble at all, and they say, Doc, I can't take this. No, do something about it. Other men, in my opinion, suffer, but to them, they can say, well, I don't, to them is all right, because the problem didn't come overnight. It occurred gradually, so they tend to sort of accommodate, right? So that's a very important thing too, so guys could get together and lime and compare notes and wonder, well, why is he getting that and I am not? Right? So that's an important concept. And then, what will work today, remember, you're taking it all your life, because if you stop, the problem will come back. But sometimes you're taking it, and the problem over a period of time gets worse. So we now have to go to the next level, which is surgery.
Okay.
Right? And that's a different concept. But what I can say is the surgery we do is we don't usually cut you open.
Okay.
We work through your penis. So it's still surgery, but at least you don't get a cut, right? But we see a lot of people, especially when I was in the public service, people would get what we call stoppage of water, like, unable to pee. It's very painful. They go to casualty. They put in a catheter, which is a rubber tube through the penis into the bladder. I mean, when they reach that stage, they're in agony. Put in the tube, the bladder is empty, and like that, immediate relief. Immediate, right? But now you have the tube, and then start the medication and give the medication time to work, and then after a while we take out the tube and they're able to pass urine to their satisfaction, and then they get overconfident and stop taking the medication. And then the problem comes back. Because the tube, again, is not natural, right? And some men tolerate it, many men tolerate it surprisingly well. As a matter of fact, sometimes it comes a stage when the medication stops working. In other words, you're taking the medication and you still get stoppage of water. Yeah. You put in the tube and then you take out the tube, and a few days later you have to put it back in, and they say, well, now we need surgery. But a lot of men actually say, Doc, I'm all right with this. I reach a certain age, I can live with that. I prefer to have this than take the chance of surgery. Because, and a lot of people are afraid of surgery too. And this is a problem that tends to occur in the older age group, not the younger age group. And so we believe that, well, a certain age, surgery is dangerous and so on, which is not necessary. Sometimes it's true, but not necessarily. It's the surgery depends on the results of the safety test.
Okay.
Right? If you pass that safety test at 80 years old, you could fail the same safety test at 60. We'll operate on an 80-year-old, but not the 60-year-old, But anyhow, so the next stage is surgery, which we do. We usually don't cut you, although cutting you open is an option. Sometimes it's necessary if it's so big. So that is sort of talking about the BPH or the enlargement, which is very, very common. A word on the inflammation.
Yes, the inflammation.
Yeah. So the inflammation is called prostatitis, and to tell you the truth, there's more about prostatitis that we don't know
than what is known.
All we know is that it's not dangerous, but it certainly is or can be a nuisance. The way I explain to my patients, I say, listen, prostatitis, we can't cure you. It's for life. We can make you feel better. We can treat you, and you'll feel better, but it will come back. That's why it's a nuisance. Now, it may come back next month, next year, in 5 years, 10 years, but invariably it will come back. And the thing about prostatitis, BPH2, the enlargement, all of these cancer, all of these prostate problems, BPH, inflammation, prostatitis, cancer, they all can cause the PSA to be elevated. So you see the challenge now, They all have the same symptoms. They all can increase the PSA. So the art now is to determine which one is which. So that's why we have to do tests and so on, which I could talk about subsequently. Just say that we call it biopsies, take samples. Right? But the prostatitis now, we know it's inflammation. Sometimes we believe it's infection, but we don't really know. Sometimes, so some men is infection, some men is inflammation. So you know what? We just treat for all two. We give you medication to stop the inflammation, and we give you antibiotics too in case there's an infection, right?
But what can cause inflammation of the prostate?
We're not sure. Sometimes, yes, it could be an infection, but when it's an infection, it's not an infection that could be sexually transmitted.
Okay.
Not at all, right? As a matter of fact, it's not the same as a bladder infection, and you could have a bladder infection which does not affect the prostate at all, and vice versa, right? A prostate infection could make the bladder irritable, right? And want to pee a lot and so on because it's right there, and inflammation in the prostate can irritate the bladder because they're right there. But no. So what causes it? We're not really sure, right? And there are a lot of complicated theories, and so it's no point getting into now because they're only theories anyway. All right, but it is a very common situation, and again, it's very common in middle-aged men. Right, so you see, we're starting to get a trend here, right? We're seeing that the prostate can give a lot of trouble. There are three primary conditions, difficult to tell the same. And so what we do is we rely a lot on the examination in the PSA. So if the PSA is elevated, then we should go on to do further tests to rule out prostate cancer, because that's the one that's dangerous. Sometimes the prostate may feel abnormal and the PSA in fact is normal, but remember I said that the PSA could be normal and you still have cancer. So, and if that's picked up, or a lesion or suspicion or something abnormal picked up with the finger examination, then also you need to proceed to biopsy. A biopsy is taking samples. Again, it's not an operation. We don't cut you. We have special instruments that we insert in the back passage, and the special instruments because they built into these instruments are miniaturized ultrasound machines, and without going into detail, the same instrument has a gun that fires a very thin needle that will go into stick the prostate in and out, but the needle is hollow. So it's like, if you have a pipe and you trick it in the mud, you get mud in the pipe. So that's how we get the sample. So experience is very much like going to the dentist. You go make the prostate numb, and then they will do what they have to do, and then you walk out and go home and take it easy, right? And then we wait for the lab result, and then we will know
what is what.
And that's a fairly common procedure. So the PSA actually is a very useful tool, so I encourage men to do the PSA once a year and so on. And also we don't only look at the absolute level of the PSA, right? We sometimes look at the rate of increase. So if you come every year and the PSA is at a certain level and stable at that level, and then we suddenly see a jump, we may get concerned, and may want to do a biopsy, even if the PSA is in a normal range, whereas if it all the time is like 1.2 and suddenly reach to 3.5. Why? Right? That would lead us to do a biopsy. But the converse is true too. A patient may come with a high PSA. We do the biopsies, so we know it's not cancer, but the PSA is high, and every year we follow it, and it's staying around the same, but it's still high, but we've now shown that it's not cancer. So that high PSA is your level of PSA, if you see what I'm saying. And but if suddenly now it jumps for no reason, then we may want to test again, right? So as I said, it's a lot of judgment and so on involved in it. But so the prostate can give issues, and we just go and need to get these things checked out.
So Doc, let's take a final commercial break, and when we come back, I would like to ask you briefly on the different types of prostate cancers, and then we can open our telephone and take some calls. So stay with us, folks. We'll be back with you in just a moment.
Drug abuse, cancer.
The most anticipated family fun-filled event on the GBN calendar is back. The Maggie King of the Grill. Join us on June 4th at Mont Rouge. Be part of the culinary masterpiece as the best grillers on island compete for the coveted title of the Maggie King of the Grill. Think you have what it takes? Be part of the action. June 4th. Book your spot. If not, step away from the grill. If you can't handle the heat. Maggie King of the Grill is sponsored by Maggie, Matook's Barbecue Sauce, Rubis, Dasani Water, Calico Shopping Center, Duty Free Caribbean, and Siesta Hotel.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at its locations on Wall Street, Grand Anse, Victoria Street, Grenville, and Central Deputy Street, Wharf. Kittens Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Kittens Healthcare, where your health is our priority.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so glad to see. Peace of mind, that's our service guarantee. We look after all our family, yes we do at every opportunity.
Antilian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spicile Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spicile Imaging provides an authentic MRI scan. Here's another little known fact. Spicile Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grand Anse. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679. or 406-1500, or visit any of our 3 locations. Spicile Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
The most anticipated family fun-filled event on the GBN calendar is back. The Maggie King of the Grill. Join us on June 4th at Mount Rouge. Be part of the culinary masterpiece as the best grillers on island compete for the coveted title of the Maggie King of the Grill. Think you have what it takes? Be part of the action. June 4th. Book your spot. If not, grill. If you can't, handle the heat. Maggie King of the Grill is sponsored by Maggie, Matook's Barbecue Sauce, Rubis, Dasani Water, Calico Shopping Center, Duty Free Caribbean, and Siesta Hotel.
If there was ever a time to keep and stay healthy, it's now! We at Hills and Valley are here to help you take deliberate steps to maintain your health. We stayed true to maintaining the most comprehensive rates while stocking the widest range of medicines and health devices, including personal protective equipment. There are so many benefits shopping with us. You get great savings through discounts for senior citizens and reward cards for loyal customers. Ask about owning yours today. Visit us at Halifax and Grenville Street, St. George, Jubilee Street opposite the Grenville Bus Terminal, and at Hillsborough, Carrico. Our wholesale distribution on Halifax Street also stocks the widest range of pharmaceuticals. We are with you on the hills and in the valleys. We are Hills and Valley Pharmacy.
When a loved one passes on, we all need the comfort, support, and guidance of a trusted friend. You can rely on LaCour Brothers Funeral Home. We provide a personalized professional service that exceeds all expectations. Our dedicated staff responds to your every need with the greatest detail, ensuring affordability with a variety of options. Our upgraded state-of-the-art facilities, spacious air-conditioned chapel with live internet streaming, a modern, environmentally safe crematorium, the only of its kind on island, private viewing spaces, large on-site repast center, a modern transportation fleet. Join our burial society today and make personalized arrangements for that final moment as you prepare to enter your loved one into eternal rest. Visit or call LaCour Brothers Funeral Home and select a package that brings added comfort to the entire family. LaCour Brothers Funeral Home and Burial Society, continuing a tradition of excellence.
Drug abuse, cancer,
measles, diabetes.
Welcome back, everyone. It's Dr. in Call. Dr. Yearwood, we have a couple of questions for you from our Facebook viewers and also on our WhatsApp platform. Let's take the Facebook question first. So someone from England, actually. Yes.
Far away.
Yes, yeah. Very interesting programming. Can bad lifestyle and nutrition affect one's prostate, or is prostate problem hereditary? That's the first question.
Yes and no. Let's deal with lifestyle and nutrition. What we're talking about here, like many other medical issues, we're talking here about risk. So everybody is born with a given risk for something. So let's deal with the prostate cancer, for example. We are born with a risk of prostate cancer. Some of us are born with a higher risk than others. Why someone may have a higher risk than another, we don't have all the answers, but we do know that it can run in the family. We do know that, for example, that this gene we talked about, the BRCA gene, is definitely a risk factor. Now, there is a difference between hereditary and family history. A lot of us sometimes confuse the two. So, like the BRCA gene, that's hereditary. The BRCA is like you have genes for blue eyes or genes for being short or tall. That's hereditary. You pass those on. That's in your DNA. Risk, family history now is where people in your clusters in your family. So if my father and then I'm at increased risk. It's not that I will catch it or get it, but like the same way I will be short or whatever, but I'm at increased risk. So we are all born with a risk, whether because of a family history or whether we actually have a gene that we can identify and pass on to our offspring. But we can modify that risk by how we live, right? We can't make it better, but we could make it worse. So this is where lifestyle and diet comes in, and that is to keep the risk we are born with at that same level, not to make it worse. So the risk factors in prostate cancer, for example, are diet high in fats. So what is recommended is eating more fish and white meats like poultries and so on, bearing in mind though that like chicken can be quite fatty. So when we talk about poultries, we talk about cleaning the fat from under the skin, right? Fish doesn't have that problem, and then they've identified salmon and tuna as to be actually even more beneficial than the other fish, right? But that's not to say you can't eat meat, Right? It's just what we're saying is that you don't only eat red meat. Right? And then the exercise, yes, like other things and other cancers and sicknesses and so on. If you don't do any exercise, you increase the risk. We don't really know why, at least I don't know why. But to the best of my knowledge, nobody really does know why. So those are two classic examples of how lifestyle could affect your risk, but by making it worse.
Another question, is there possibly an exercise a man can do to strengthen his prostate?
No, because remember too, although the prostate is surrounded by this muscle, as I said, right? That muscle is not part of the prostate. The prostate is actually a gland, right? So it has no strength per se. Right? It's like a salivary gland, it secretes things. It secretes fluid, which is the fluid that gives nourishment to the sperm when the sperm is on its journey to find and fertilize the egg.
Okay, wonderful. Another question this time from on our WhatsApp platform. Good night, Dr. Yearwood. It is said that prolonged prostatitis can cause cancer. Is that true?
No. At this point in time, no. There's no evidence to suggest that. So you see, prostatitis, remember, prostatitis, cancer, and BPH, they're all separate and independent entities. And I stress entities. I stress independent. Right?
Yes.
And a man could have any combination there of 1, 2, or 3, right? So yes, no, it wouldn't cause prostatitis, but prostatitis wouldn't cause cancer, but prostatitis can cause your PSA to be high, which would then set into motion a process by which, if you happen to have cancer by coincidence, then the cancer will be discovered. But there is no relationship between the two.
So you can someone present with all 3?
Absolutely. You see it all the time. They have 3 problems.
Cancer, prostatitis, and
enlargement, yes. And but the only thing that is dangerous there is the cancer. Right?
Okay.
But diagnosing the other 2 can get in the way of diagnosing the cancer. You see, that's why it becomes so complicated. But I suppose that's why you have specialists.
Okay. Doctor, are there different types of prostate cancer that can present?
Yes. If we decide to classify prostate cancer in terms of their aggressiveness, we know that some prostate cancers are not aggressive at all and can take a very long time to do you harm. At the other end of the spectrum is prostate cancers that are very aggressive, and no matter what we do, we cannot cure it unless we pick it up very early. That's why early detection is key, because even aggressive cancers have a high rate of cure. And we assign cancers a score. So we say, for example, the least aggressive cancer would be a score of 2, and the most aggressive cancer would have a score of, let's say, 10.
Okay.
Right, and or if we don't use that number system, we could use another number system from 2 to 5. Right, but it's all basically giving us an idea of how aggressive that cancer is. And we get that from when we do the biopsy, which is they take a small piece of the prostate tissue, they process it, and it goes to the lab, and they look at it under magnifying glass, maybe 400 times 400 magnification, and those specialists are called pathologists, and they can tell the clinicians what exactly we're dealing with, and once we know what we're dealing with, we can then plan accordingly the treatment. So not everybody gets the same treatment, but just to give you some reference, so the very or the non-aggressive, tame prostate cancers that are got early, we don't even treat them. We monitor them, and that is called active surveillance. We monitor them very carefully and closely. That's why we say active surveillance. But the reason we don't treat them, and of course they have to meet certain criteria, right? But once that criteria is met, it's because we anticipate that the patient with that type of cancer would die of old age or something else before the cancer could take them. Right? And therefore, if you die with prostate cancer, not from prostate cancer, well, that's come like a cure too, right?
Well, of course.
And the treatments for cancer, can be quite rough on the body. So if we could avoid having to treat you, but it's useful to know that you have it, because although that's a prediction, it's only a prediction, and it's like the weather. it could be wrong. So we have to monitor it very closely, because sometimes a type 2 prostate cancer, for example, can over a period of time change to upgrade to like a type 4, in which then we know we have to treat it.
Okay.
All right?
Okay. That's very interesting. Dying from and dying with, a difference there.
Yeah, and again, it's not just philosophical; it's actually practical.
Right. Okay.
You know.
So, callers, we have a few minutes. We can take a call or two from you. The telephone number is 435-2041. So, if you have any questions that you would like to ask Dr. Yearwood, you can do so now. The number again, 435-2041. Let's go to our telephone. Doctor and call. Good evening.
Good evening, Godfrey.
Yes.
Good evening, Doc.
Yes. Good evening.
Doc, I know that I have.
Sorry.
I know that my prostate is enlarged.
Yeah. Good evening, caller. Yeah. Say what you have to say. I'm not hearing you now.
I said that I know that I has.
Okay, caller, you need to turn the volume of your.
The volume is really low. I have no volume on.
Okay, so let's try again. So go ahead.
But Dr. Yearwood, my prostate has been enlarged, and I know that for a fact because you told me so before. I had 3 biopsies before. One in no doc. One when he was at Ocean House. No, he's still at Ocean House, but the first one was at Tantin. And you told me it's not prostate cancer, it's prostatitis. And the reading for that was 3.5, and it's almost 10 years. But the last time I went to the States, it went to 14. And what I was told that the prostate grow with age. So and the other thing, I pass urine very, very regularly. I was on a tablet called a medication called Flomat, which it stops it for a period of time. But if I'm sleeping at night, I go to bed around 10 o'clock. I don't. But if I'm on my feet, every 20 minutes I'll pass urine.
Right. So you are actually a good example of what I've been saying before, and that is one, not every elevated PSA is prostate cancer, and even if the PSA is within the normal range, if it feels there's something there that doesn't feel quite right, that it could be cancer, we biopsy it. And then even when the biopsy comes back as not cancer, as in your case it showed prostatitis, we don't say goodbye, have a good life. We continue to follow you up. And then the PSA would have gone up again, or the irregularity that was felt with the examination may have got a little bit worse. So you would have had another biopsy and it came back as showing prostatitis. And then now many years later, so we know you're not cancer because you're still alive without treatment, right? So then many years later, it would jump to 14. And that is worrying, right? So I imagine, although you didn't say so, I imagine you would have had another biopsy in the States. And they would have told you that it was just if it was cancer, they would have found it and said it was cancer. So you see, you're demonstrating a little bit of the issues that we feel, that we experience with the prostate, knowing that, you see, you can have one or two of the same things, one, two, or even three of the abnormalities simultaneously at the same time. And in this case, you have prostatitis at the beginning. Now, I left Tantine in 2003.
Oh.
So, the prostatitis is still there, but since 2003, the prostate has continued to get bigger, as it does. right? And now your PSA has reached 14. But thank God, when I assume it was tested in the States, it's still not cancer, but is enlarged. And a lot of the symptoms that you're seeing, right, is due to the enlargement, the BPH, and could be also manifestation of the prostatitis that would still be there. And what is happening now, also what we see is that the medication you're taking, which is the medication that relaxes, right, while it was working at one time, is no longer working as well. So we now have to think, well, what are we going to do? Maybe that we want to now add to what you're taking the medication that shrinks the prostate. It seems to me your prostate has gotten big enough to try that medication. Of course, we won't know if it works for another 6 months or so. Right? The other thing I want to say about this medication, which I think is important, is that this medication, although it shrinks the prostate, it reduces the PSA artificially by 50%. So when you're on this medication, let's say, and you do the PSA testing, it comes back at 3. Then you have to multiply that, so it's really 6, not 3. And that also occurs to many herbal products. You know, it's very easy to access herbal products. You can get them online and so on. And a lot of these products go as far as to say that they can prevent prostate cancer, or they could even treat prostate cancer. And they say, look, I had this PSA of, let's say 10, and I took this herbal product and now it is 5. That is because, like the shrinking medication, it has reduced the PSA artificially, giving a false sense of security. Wow. And that's why we have to be careful about these things. And a lot of these things you don't read in the box. Okay. Right? Especially the herbal things.
We have another question on our Facebook page. Someone is asking, is high alcohol consumption a risk factor for any of those prostate ailments?
That's a good question, and I will have to say I don't know if it can cause prostatitis, but it can make prostatitis feel worse. Okay. For sure. I don't think it causes cancer, right? Mm-hmm.
All right. Do we have another call online? 435-2041. Let's try the telephone again. Doctor and call. Good evening.
Good evening.
Yes, good evening, caller.
2 questions. One, there is on a documentary from BBC, I saw that they have discovered or developed a blood test to show when you have the aggressive, they say there are generally 3 aggressive type of prostate cancer, and they have developed a blood test that will tell you if you have any of the 3. And so I want to know if we have that technology anywhere in the region. And secondly, not directly concerned with that, can vasectomy have any adverse effect on you over time? Thank you very much.
Right. Thank you, so I will deal with the second question first, because that's the simplest question. Mm-hmm. No. Vasectomy has been many times argued or claimed to be a risk factor for prostate cancer, but that is not the case. That has been put to rest now for a while. Now, with respect to the other issue about blood tests and so on, yes, so there are actually several tests being developed, but none of them are yet have reached the stage of reliability to become mainstream. So these are not available, these would not be available in the Caribbean nor routinely anywhere else. They may be available as research tools, because once someone develops a test, now they have to test it in real life. So they may now turn around and give that to other large research institutions to run the test, because you need a lot of numbers to see whether it really works or not. But there are many different tests. This one in BBC may be one. There are tests looking at the genetics. Then they have different markers beside PSA. They even have tests where they test the urine. They even have tests where they have dogs sniffing patients or sniffing the urine. I mean, they're looking at many, many different ways, because what we have been able to show tonight, especially with the patient that saw me previously, is that while PSA is useful, it's not perfect. So yes, there's a lot of room for improvement, and there's a lot of research going on, but we haven't got there yet.
Okay, let's go back to the telephone once again. Doctor on call, good evening.
Good evening, Godfrey.
Yes, good evening.
Yeah, good evening, Doc. Godfrey, I joined the program a bit late, so I don't know if you have covered about the question I'm going to ask, actually.
Go ahead.
Okay, what happened is I don't seem to have control over when I want to urine. I have to go immediately, and if I don't do it, I'll wet myself, Doc. Could you tell me actually what the problem might be, really?
That is probably a prostate problem. We had actually talked about that as a symptom initially, and I cannot be more reassuring or more specific. All I can say is probably is either enlargement of the prostate, BPH, inflammation of the prostate, prostatitis, or prostate cancer. It could be any one of those, or people may have more than one of those things, and each one of those things are adding their little 2 cents to make the problem bigger. But I would advise you to go to your regular doctor, let him examine you, do some tests on you, and see. It could even just be a straightforward bladder infection. There's so much it could be. But you need to certainly get it checked out, because obviously it's a big bother to you.
Okay, let's take another doctor. I mean, they're coming fast and furious. The doctor on call, good evening. Hello? The doctor on call, good evening.
Hello, good evening, Godfrey, and good evening.
Yeah, can you speak a little louder, please, caller?
Yes. What I want to know is that how do we know which one of the 3 do we have? Hello?
Okay, caller, thank you. Yes.
Yeah. So we start off with a biopsy, which is taking a sample of the prostate gland. That's really, at this point in time, the only way we can know, right? For sure.
Right, and Doc, we have another one here on the WhatsApp platform. It says, bearing in mind that a percent-free PSA of under 10% poses increased risk of cancer, please comment on a reducing percent-free PSA level of 15% down from, say, 25% within, say, a 6-month period.
Right, so I know we have much time, but let me see if I can cover. This is a very good question. So we established that PSA, if it's high, could be any of those 3 entities, right? So percentage-free PSA now is a derivative of PSA. And what that's trying to do is to see whether we could tease out of a given PSA to see whether or not we can identify for that given PSA where the risk of prostate cancer is versus, let's say, the risk of prostatitis. So let's say a patient has a PSA of 12 and the percentage-free PSA is less than 10, then we become very concerned that it is prostate. It could be there's a high risk of being prostate cancer. It doesn't mean it has to be, but there is a high risk. Now let us look at the other end. Suppose the PSA was 25%. Then while we're still concerned, because none of these things are foolproof, but it weighs now us to think, well, you know what, this is more likely to be prostatitis than prostate cancer. And then you mentioned 15%, that's kind of like halfway. So that's on the balance, right? 50-50. But again, these are just to help us one thing in a complicated formula to come up with a management decision, right? So a patient like with a PSA of 25% risk for 50, let's say that patient with 12 and the percentage-free PSA was high, let's say 30%, I would say, you know what? And I didn't feel anything suspicious when I examined the prostate. I would say, look, there's a good chance this is inflammation. Let me treat you for inflammation and see what happens. If as opposed now, a different patient with the same PSA of 12, but the percentage free was 6, I say, you know what, I can't afford to take chances. Let's just go ahead and biopsy you now. So that is how it is used. It's not an absolute.
Right. And Doc, one final interesting question here on our WhatsApp platform. Someone is asking, good night, my son is 16 years, and sometimes when he passes urine, tears will be coming out his eyes. What is the cause of that, and what can I do to help my child?
That's a hard one. You know, at least it's hard for me because I've never seen, heard, or read about such a situation. The only thing I could ask is, you know, sometimes when people are peeing, it can be painful for other things. And is it because tears are coming out of his eyes because he's feeling a lot of pain and trying to grind it? I don't know, right? But that is a condition that I'm sorry I really can't help you with. I've never seen or heard or read about it before. It's certainly very rare.
Yeah. What I would suggest, maybe the caller needs to take the son to have the child examined by
absolutely
you know, we can't,
general practitioner.
Yeah, definitely because doc cannot do any diagnosis via the phone. You have to, you know, see what's happening and then take it from there. So doc, that's all the time we have this evening. Let me say that I want to ask you to return maybe sometime soon so we can cover some other areas. I would like us to speak on some other conditions that can affect men, like testicular cancer, erectile dysfunction, which is a very common one. And so hopefully, you know, once your schedule permits, we'd like to have you
sure,
back.
It will be a pleasure. And I mean, but don't leave out the woman when you get angry.
No, not at all.
So they have other women conditions too, not gynecological, but I'm thinking in terms of like breast.
Well, of course.
And then the other conditions too, like thyroid and so on. Men and women get that. Women more than men. But no, I'll be happy to be here and to talk about these things. You know,
Yes, indeed.
I'm very happy and thank you very much. And I must congratulate our audience. We've had some very good and challenging questions.
Yes, indeed.
Thank you.
Yes, indeed. So thanks again. Thanks to our callers, our viewers on the Facebook page and YouTube channel. We thank you very much for your comments and your contribution. You can join us next Tuesday for another Doctor and Call. So thank you very much again. Until then, do have a good night. All the best.
Cancer,
measles, diabetes, AIDS,